Come in. Come in.
Hi,
Hello.
Mrs. Smith.
Yes.
Hi, I'm Dr. Riaz. I'm the radiation doctor. I know Dr. Marino's talked to you a little bit about the role of radiation for your cancer. Okay, what's your understanding sort of
Well, I've got a couple of more sessions of chemo, and then he kind of hit on this radiation. It just, the chemo's taking such a toll on me.
Right,
I don't know if I want to keep going.
sure. The chemo is definitely the toughest part of the overall course of the treatment. And you know, when the chemo comes to an end, the fatigue from the chemo and some of the side effects from the chemo are going to resolve, and you're definitely going to feel significantly better. But the chemotherapy, out of the three parts of this treatment, the surgery, the chemo, and the radiation, I think most patients find the chemotherapy the hardest, although it is sort of a very critical component. So I think, as Dr. Marino's probably told you, you have a locally advanced form of breast cancer, and our standard treatment for that, which you received the first two components of, is surgery to remove the tumor and the lymph nodes, followed by chemotherapy to sort of neutralize any microscopic cells that might have escaped the breast. And then we give radiation to the chest to prevent the cancer from coming back in the breast itself. The radiation itself involves about 5 to 6 weeks of treatment. It's every day, Monday through Friday, for 5 days a week. So it's a little bit of a time commitment. But before the treatment begins, we would do a CT simulation scan. We would make little marks on your body, little tattoos, and the therapists who you're gonna see every day use these marks to line you up. The treatment itself is delivered in a big open room. The machine rotates around you and shoots focused radiation at your chest. You're not going to feel anything whatsoever while the beam is on. I'm going to see you every week while you're on treatment to go over any side effects that might occur, and we'll handle them as they come along. The main side effects from this treatment, short term, are some mild fatigue, but nothing as severe as what you're going through with the chemotherapy. And then a bit of a rash over your skin. In some people, this rash becomes a little more severe and their skin breaks down a little bit. I'll see you every week and we'll assess your skin every week, and as things, depending on how your skin does, we'll adjust sort of the creams we provide you to take care of your skin. Your skin will go back and heal to normal after a treatment is over. Those are most of the short-term side effects from the radiation. Again, the reason to do the radiation in your case is to prevent the cancer really from coming back in the breast or in the chest wall itself, which we know is one of the highest areas at risk for the cancer to come back. Does that make sense?
Yeah.
Do you have questions on what we've discussed so far?
Sure, I've got a lot of questions. So once I'm finished with all of this, then does that mean I'm cured?
Right. So, once you go through all these three parts of treatment, we're going to hope that you are cured, but the only way of really knowing if you're cured is just with the test of time. So typically, if the cancer is to come back, you're at the highest risk of the cancer coming back in the first 2 years after you finish treatment. So during those first 2 years, typically your surgeon, your medical oncologist will alternate and see you every 3 months and examine you carefully to make sure the cancer doesn't come back. Once you make it past 2 years, the chance of the cancer coming back is less, but it's not zero. And typically after you make it out 5 years, we usually consider people cured, although there's a very, very small chance the cancer could still come back. I think if you make it out past the 2-year mark, you've made it past the biggest hurdle, and then 5-year mark is sort of the second hurdle. But you're doing everything right, you're going through all the right steps, the surgery first, this chemo, which I know can be a little bit rough, and then the radiation, I think you're going to find much easier than the chemotherapy.
So,
the long-term side effects from the radiation, which we haven't talked about just yet, there's sort of mainly two. One is that the radiation could damage your implant, and so you might need to have your implant replaced in the future. The chance of that's probably in the order of 10 to 20%, something like that. But again, if that happens, that's something the plastic surgeons are very capable of taking care of. And then the second risk factor, the second long-term side effect is that radiation to your chest can occasionally put you at a slight, very, very slight increased risk of developing heart disease in the future. But this is something we would just have you manage by being on top of your diet, your cholesterol with your primary care doctor. Those are the two major long-term side effects of this type of treatment. Let me back up. There's one additional one, which is occasionally you can develop swelling in your arm, or lymphedema in your arm. But that nowadays is much rarer. Those are the three major complications from this type of treatment in the long run. Do you have questions about those?
With the treatment, every day, I mean, I've got an important job and
Yeah.
I'm barely able to keep up with it now. I don't know.
Right. So we do have to do it every single day. And it's important you don't miss a day, because if you miss days during treatment, the radiation becomes a little bit less effective. We are open from 7 a.m. to 7 p.m., so we can try and figure out a time that will work sort of best for you, whether if it's before work or after work. I think most people are able to work through this treatment if that's what they want to do. And again, I think you'll find this much less taxing than the chemotherapy you've been on. So I think you'll find this a bit easier to go through. Are you working through chemo?
No, well, I'm trying to, but
Right. Yes,
I'm
I think
making an effort.
I think if there's a time people take time off of work during treatments, typically during the chemotherapy, because that is the most taxing part of this whole course. So I think, you might want to, we're not going to start the radiation right after chemo. We usually wait a few weeks. So I think continuing to take some time off while you're recovering from chemo, and then even maybe taking the first week or two off of work during radiation just to see how you tolerate it. And if things are going well, then going back to work maybe in the second or third week of radiation is sort of a very reasonable course of action. I know it's sort of a long course with a lot of things, but it sounds like you've done very well up to this point.
Trying.
Do you have other concerns or questions I can answer?
Sure. When I'm finished with everything, then what happens to me? Is like some kind of follow-up? I mean,
Right, yeah. So, between me, your medical oncologist, and your surgeon, we'll rotate and we'll see you every 3 months, basically, for the first 2 years. Typically, we like to get a mammogram once a year for your other breast. And so we'll do careful examinations at each of these visits to make sure the cancer has not come back. And after the first 2 years, we usually space things out because the chance of the cancer coming back after 2 years is less than it'll usually be every 6 months. And at the 5-year point, you'll just see one of us every year. So that's sort of our typical follow-up plan after this, you make it through this sort of marathon. Make sense?
yes, it does. Thank you.
Anything else I can help you with?
No, I'm just exhausted.
I think that's very reasonable for all that you've been through, but the light, you should be starting to be able to see the light at the end of the tunnel. Things are gonna get easier. The chemo by far is the hardest part of treatment. Every single patient typically finds it the hardest part, so things will get easier. Just make sure you do something to celebrate when you make it through the end of this, or reward yourself if there's been something you wanted to buy
Yes.
or eat or something. Now is the time, or right after is the time to sort of do it. Okay.
Yeah.
It was nice meeting you. You know, if you have any questions, anything like that, I'm gonna see you at that simulation scan. We can discuss it at that point, or you can always call my office. And again, I'm gonna see you every week during treatment. So as things pop up, you should just feel free to ask. Okay?
Will do.
All right. Good luck, and I'll be in touch with Dr. Marina and let her know about our
Thank
discussion.
you. Thank you so much.